Hello, good afternoon everybody. I will be talking to you on design and organization of curriculum. So first of all, we will see what is the definition of curriculum design. According to Hilda Taba in 1962, curriculum design is a statement which identifies the elements of a curriculum, states what their relationship to each other, and indicates the principles of organization and requirement of organization for administrative conditions under which it is to operate. So in simple terms, curriculum design or curriculum organization is the arrangement of elements of curriculum into a substantiative whole. So curriculum design and organization, when we think, the curriculum developer will have some planning well in advance to formulate the following elements. The first one is the curricular aims, goals and objectives, and the selected and appropriate curriculum content, learning experiences and evaluation procedures. The organization of these components of a curriculum into a coherent, meaningful curriculum plan is termed curriculum design. Three notions of curriculum. Johnson identified three notions of the curriculum design as: the first one, arrangement of selected and ordered learning outcomes intended to be achieved through instruction, an arrangement of selected and ordered learning experiences to be provided in an instructional situation, and thirdly, a scheme for planning and providing learning experiences. Then let us see what are the factors influencing curriculum design. These factors are philosophical, psychological, sociological and historical orientation of the curriculum developer and the requirement of the course or program. Design decisions should be in consonance with our basic beliefs about who are the people, what and how they should learn, how they should use their acquired knowledge, and for this we use our philosophy and learning theories. Let us see what are the dimensions of the curriculum. Before going into this, I would like to explain a little more about curriculum design as curriculum design. That is, based on the definition, we can say that in designing a curriculum, whether for a whole program or for a particular unit, we are planning an intellectual journey. This intellectual journey for what? For whom? For our students, which included series of experiences that will result in them the learning what we intended them to learn. And then we have to think about the dimensions. When we think about the dimensions of curriculum design, we can see there is a scope, continuity, integration, articulation, sequence and balance. All together, this will come in our curriculum organization with vertical and horizontal organization of the so the components of design are, when designing a curriculum, we should also consider the nature and the arrangement of four basic parts. This is according to Gill's 1942. So you can see, before all of us were born, people identified the components of the curriculum design. The first one is the objectives, what should be done. Then the content, what subject matter should be included. Then learning experiences, what instructional strategies, resources and activities should be employed to develop the curriculum. Then Finally, the evaluation. What methods and instruments should be used to judge the results of the curriculum? Then, components of design. Again, curriculum design involves issues based on three basic ideas. These three basic ideas are the theoretical contents, philosophical viewpoints, and the practical experiences. These three issues should be considered, and then from this we will make interpretation and selection of objectives, selection and organization of the content, decisions about how to teach the content, evaluation of the developed curriculum. Then sources of curriculum design. We can see many sources here: learner, knowledge, society, science, moral doctrine. When we think about this learner, who will be coming to learn the course? For example, in health sciences, we know that students or candidates who passed +2 with science may be coming. They have a basic idea about the sciences, so we can make on whatever the base is the science. You can add on courses like anatomy, physiology, microbiology, all basic sciences in the first year we keep. See, learner is a person who is oriented to science subjects. Then what knowledge you wanted to give. Yeah, if you take the subject anatomy, what all things you have to add for them to learn nursing, or them to learn medical laboratory technology or cardiovascular technology. All this you will see. Then who is the society who is going to benefit from these learning from these candidates? They have to serve the society. So the basic characteristics of the society has to be taken. That is why we talk about culture, ethnicity, all those things in our classes. Then about science. Contains only observable and quantifiable elements. In science, we give priority problem solving and thinking strategies, and this also emphasizes learning how to learn. Why? Because the knowledge increases so rapidly. The only constant seems to be the procedures by which we process knowledge. When we think about society, again, once more I wanted to tell you, we draw ideas from analysis of social situation, operates within social and economic and political context. The courses, the institute, all these are part of society. We take the priority as addresses students' unique needs and diverse social group. All these are very important. And again, once more I wanted to tell you about learner. Curriculum derived from our knowledge of students is very important also. Then moral doctrine. What is your internal feeling about morality, and how society views this, and what type of philosophy you possess? All these come in this area. Then guidelines for curriculum design. This is very important. When you wanted to design a curriculum, you cannot make it from scratch. It is difficult. So you should have somebody along with you if you wanted to develop a curriculum. The first is creating a design committee. Then create a schedule meetings to make curriculum design decisions. Gather data about educational issues and suggested solutions. Process data on available curriculum design. Compare cost, scheduling, students' characteristics and academic strengths, learning environments, whether community accept the design, that also has to be considered. Then schedule time for reflection on design, schedule time for revision of the design, explain design to educational colleagues, community members, if appropriate, to the students too. Then we can see the conceptual framework. curriculum organization has a conceptual framework. This one, you can see the first two arms are talking about horizontal organization and vertical organization. We said we will have aims, learning experiences, the content, all those things. How we will plan this? We can organize it into horizontal organization and vertical organization. Horizontal organization, when we consider, we may think about scope, integrity, or integration of contents. Then in vertical organization, we may think about continuity, sequence, balance, etc. Not all things are mentioned here in the then organization of curriculum. Designing a curriculum takes into an account horizontal and vertical organization, which I have already told you. When we think about vertical organization, it is the longitudinal arrangement of content as reflected in the presence of sequence, continuity, and vertical articulation in the curriculum. And when we think about horizontal organization, it is the arrangement of content, skills, and processes from the viewpoints of scope and horizontal integration. This is taken from RACE 2000. So now you understood what is important, what is the importance of vertical and horizontal organization of the learning experiences in a curriculum. So once more we'll talk about horizontal organization. What is it? The horizontal organization in a curriculum means that what is studied in one particular course in an institution is in line with the other similar classes, both in the terms of course content and evaluation. If you are teaching nursing, diploma nursing or BSc nursing, certain things are similar. So similar contents can be arranged in the similar year and can go to the higher levels. For example, a chemistry class might require students to acquire algebra to balance the molecules H2 plus O2 is equal to H2O. That means hydrogen plus oxygen gives water. This is known to all of you. If you do some of the mass calculation, you will find that 2 grams of hydrogen and 32 grams of oxygen makes only 18 grams of water. What about the other 16 grams? You have to balance it. That is why we always talk about 2H2 plus O2 gives water. You may be remembering the law of conservation of mass using algebra. That is the quadratic equation that you have learned. So horizontal integration or a horizontal curriculum add maths and chemistry together in the same area. You teach in the maths quadratic equation, and in the chemistry you teach chemical formulas and equations. I know you all may be remembering the Boyle's law, Charles' law, all those things about constant and all which you have learned in your chemistry classes. Then vertical organization. A vertical curriculum links knowledge from one lesson to the next across the program of study. That is, if it is a 4-year program from first year to final year, we may be making the students to learn a profession like medical laboratory technology or nursing, whatever it is, medicine, etc. So from the first year to the final year, we concentrate on developing a candidate to be a practitioner in that area. So what we will do is, from the first year to the final year, there is a linkage. Vertical arrangement of bricks, which happens in when you are making a house. So base is made, then you will be vertically arranging each brick with a cement, fixing it properly. The same way, vertical organization is like that. One after another, you will be building on first year, second year, third year, fourth year, like that. Different courses in that. That courses may be arranged horizontally, but each year will be adding up to reach to the final year to become a practitioner. You can understand that now. So it establishes skills and knowledge which are used and further developed across a whole program of study. So first year, a student may learn about giving injection, then learn how to give an injection. Before that, they will learn what are the requirements or articles needed for giving an injection, what are the precautions they have to take for maintaining sterility during injections, and all these you will learn as theoretical things, and then you will be practicing how to give injections. You may be studying first intramuscular injection, after that you may be learning intravenous injection, so that see from lower level to higher level in a vertical manner each skill will be developed, and this will be continued. First year you may be little bit timid in giving an injection, and by final year you are an expert in giving an injection. See, in this way basic skills and knowledge are both developed and reinforced as other elements are introduced into the study. This method is structured and progressive, focusing on building to advanced level of knowledge. The better example in the nursing curriculum is biostatistics. When you start the basic biostatistics, you start with arithmetic mean, which you have learned in schools, how to calculate mean. Then from mean you will go for median and mode. Then frequencies you may study. You may be taking the first step as frequencies, counting the numbers, and saying that counting the list and saying that how many numbers are there. That is the frequency. But you may have to do different formulas later for finding out frequencies in a series of numbers, series of tables, all these different things. So you know from the simplest to the highest, it goes like that. That is vertical organization. The curriculum designer should ensure the sequence, continuity, and articulation are present in the arrangement of curriculum content, skills, and processes when you are using vertical organization. First one, we'll talk about sequence. Sequence is the vertical arrangement of curriculum content, including skills and processes, such that new learning is based on previous learning. Example I have told you about intramuscular injection, going back to then intravenous injection, then intradermal injection, so intraosseous injections, like that. Then the consideration applies whether one is designing a lesson, a subject, course, discipline, field of study, or program. This sequence is very important even if you are taking a class. For example, you are teaching bronchitis. First of all, you have to tell the students what is bronchitis. See, the first sequence is starting with what is it. Then you may say what are the causative agents or reasons for developing this. And then you may say what happens when bronchitis comes. That is the pathophysiology. Like that it goes on. Then how the symptoms may be manifested with bronchitis. Then you may say how will you treat them and how will you care them. See how the sequence goes on. So that is for a single lesson. This is applicable all throughout when you are designing a curriculum. So proper sequencing of learning experiences entails analysis of what contents, skills, or processes are prerequisite for the next. A well-sequenced curriculum provides for cumulative and continuous learning. Decisions concerning sequence in the curriculum are based on the following considerations. First one, logical structure of the course or field of study, chronological learning, psychological principles of learning, learners' interests and needs, analysis of how people use knowledge in their work or social functions. The sequence of contents in mathematics, for instance, is based on the logical structure of the discipline. Mathematics starts from the simplest concepts, principles, and operations to the most complex ones. One cannot understand calculus if he has not yet taken prerequisite courses like algebra, trigonometry, and analytical geometry. I hope you understood from this example why it is important to have sequence in your curriculum design. Sequence based on chronological learning is best exemplified in courses like child health nursing. You may start with the principles and concepts of child health nursing, then you may go for growth and development of different age groups, then you will go for the assessment of these children, then you will talk about the nutritional requirement, then you will talk about the preventive pediatrics, and finally you may go for abnormalities seen in children and diseases. Then content, skills, and processes may also be sequenced on the basis of the characteristics of learners at different stages of their growth and development to ensure that learning experiences are within their level of maturity and capabilities. The developmental theories of Piaget, Kohlberg, and other scholars provide useful information. Sequencing. Again, we are continuing with this. Whole to part, concrete to abstract, simple to complex, and similar other learning principles also guide the sequencing of the curriculum from the psychological viewpoint. Learners' interests and needs, another basis for sequencing content, are actually anchored on psychological growth stages of man. Lastly, sequence may be based on an analysis of the activities an adult goes through to successfully execute a performance or an activity. The hierarchical order at which the required knowledge and skills are needed in the performance of such activities guides the sequencing of the curriculum content. Next is continuity. Points of interest in vertical organization of a curriculum, as we said, includes sequence, continuity, and integration. Sequence is already talked about. And continuity, on the other hand, refers to the repetition of related elements of contents which do not directly follow one another. That means one element is temporarily separated from the first by one or more unrelated elements. The continuity allows for the recurrence of knowledge, skills, and processes with increased depth, breadth, and competence. I'll give examples for this. Find an example from nursing curriculum. Review of anatomy and physiology of female genital organs in OBG. An example of continuity in the curriculum is the knowledge of concepts and skills in identifying the anatomy of female pelvis in the first year and reproductive functions of the female pelvis in the fourth year with OBG. I hope you understood. See, when we are teaching anatomy in the first year and the physiology also, in the anatomy we may talk about female pelvis, that is the normal gynecoid pelvis, and we may say about the types of pelvis. But when it comes to fourth year, you will continue a review of female pelvis, and you may go for more on the anatomical and the physiological parameters which helps the female to bear a baby inside their womb, and the different landmarks, parameters, then the diameters, different diameters, and how the fetal head comes during delivery, and what are the relationship between the floor of the pelvis and the introitus and also the head of the baby, all these things. This will be learned in the fourth year. First year they are introduced to female pelvis. So continuity, once continuity occurs in learning, depth also will come. depth and breadth comes with the continuity of contents. The two courses do not successively follow one another, but the learning experience in the latter are built on the past experience in the former, although a greater complexity and abstraction. This is very important. Then vertical integration or articulation is a third consideration in vertical organization. Vertical integration refers to the arrangement of the curriculum in such a way that the relationship among topics or courses in a given field of study across grade or year levels are emphasized. If vertical organization is present in the curriculum, unnecessary repetition of content and gaps in knowledge can be avoided. So, vertical integration is also very important. Vertical integration can be accomplished if teachers of different courses that belong to the same field of study plan together to map out the scope and sequence of their respective courses. For example, first year foundation teachers can confer with the fourth year teachers in nursing program and in the fourth year teacher to find out where the theoretical concept should start and end. This activity will enable these two groups of teachers to know each other's expectation as to first year and terminal knowledge and skills of students of nursing on those educational levels. They will also know which content element to repeat, reinforce or review. So vertical integration across program is difficult, especially if a school offers only one of those programs. So we can, like for example, I can tell you, if you want some specialty nursing schools are there only giving pediatric nursing. See, if they are giving a pediatric nursing training only, if there is no nursing program, how can we integrate all these anatomy, physiology, all these things there? And also you may not be able to develop that integration to the other programs. Then little more about horizontal organization. We just defined it and kept it. Then horizontal organization is the arrangement of topics, themes or courses offered at the same point of time. I have told you vertical goes above one after another. Horizontal is as the term denotes, the same year, same grade, same semester, same trimester, etc. A horizontal organization is concerned with the scope and horizontal integration. Sometimes it is simply referred to as integration. Scope refers to the boundaries or coverage of the curriculum in terms of breadth and depth. That you people must remember how much we have to go, or whether we have to give a broad idea only, how much deep we have to go or not. Scope is very important because it talks about breadth and depth. Again, it answers questions like what topics, themes, ideas, concepts, principles, theories, and other forms of knowledge, that is the subject matter or content, as well as skills, competencies, and activities should be covered. The basic issue in making decisions about the content is finding out which knowledge is most worthy of inclusion in the curriculum, considering knowledge explosion. This is very, very important. We need not teach all the facts. We have to select which facts has to be taught. Once we select that, the other facts the students will learn from the other areas. So opinions regarding this issue vary depending on the philosophical, sociological, psychological and historical orientation of the curriculum decision maker. Then however, with the advancement in technology, which allows for the easy storage, retrieval and processing of information. The need for teaching too much facts got reduced. Emphasis should be focused on information retrieval and processing skills, on learning how to learn, and on development, thinking, and creative skills. But knowledge, skills, and attitude that enhance learners' self-concept and enable one to be a productive and responsible member of the community should also be part of the curriculum content. So when you are thinking about horizontal organization, scope, breadth and depth, you should think which content I should include in which area of the curriculum, and how this may be in which semester, which trimester, which year. All these will be decided with a horizontal organization. Another problem that confronts curriculum developers with respect to content is the choice between breadth without depth or depth without breadth. One solution to this problem is to minimize the teaching of knowledge domain. That is who, when, what, where, how, in favor of the thinking processes, why. This is a very important point that one must remember when you are developing a curriculum. You need not teach all the facts to the students. You can teach the basics, the must-know principles, and make them to think more and about why I learned this, and what is the importance of this knowledge to me. That has to be taught. This will allow for both breadth. Then horizontal organization, continuing the integration in the second consideration, horizontal integration. We talked about vertical integration also. Now we are talking about horizontal integration, the second consideration in the horizontal organization of the curriculum. This refers to the arrangement of content based on relatedness of topics, themes, skills, or processes in two or more subject or courses in the same grade, same years, or semester or trimester. This is accomplished by integrating separate subjects that are related. For example, I can tell you, you are teaching medical nursing in second year and you are teaching pharmacology also. See, in order to avoid repetition and also saving time and to develop integration, if two teachers who are teaching pharmacology as well as medical nursing sit together and prepare your curriculum in such a way that once you are taking respiratory system disorders, the pharmacology teacher also should take medicines acting on respiratory system. See how you can integrate and how you can avoid repetition. Otherwise, if the medical nursing teacher is taking respiratory system earlier than the pharmacology teacher on respiratory drugs, what will happen? The teacher who is teaching medical nursing have to repeat how to take the drugs acting on respiratory system, and later again the pharmacology teacher may have to repeat it. That is why we do master teaching timetable, and we'll see how this will be going on. And good curriculum developer will see this, and class coordinators who are doing best practices can do this and integrate the separate subjects in the same semester or same year. Then another approach is planning of a lesson or a mini course which integrate related concepts, principles or themes from two or more subjects. This is very, very good and best practice in curriculum implementation. How is it possible? For example, if you are teaching, I have given an example, a course on women issues can be a mini course that integrate lessons in obstetrics and gynecology about women empowerment. What is the importance of delivery? How family can be maintained? What is the importance of procreation to maintain generation? what is the important role of women in that. All this can be taught together as a mini course, so that the people who are studying, or the candidate who are studying OBG, will have empowered knowledge. The next is the balance. Is another important consideration in curriculum organization. It refers to the appropriate emphasis placed on different aspects of the content, learning experience, and intended outcomes of the curriculum. See, when balance means everything, for example, I can tell you, if you look at the syllabus given by the university for nursing curriculum, you will see that mental health nursing has 320 hours of clinicals. The same way, child health nursing also has got 320 hours of clinicals. We all know that 68% of nursing or the diseases are covered in medical surgical nursing, because the majority of issues are health issues comes in medical surgical, and the other part is given for this. So you are balancing the curriculum, saying that 68% of the medical and surgical conditions coming under medical surgical nursing, and the rest will be distributed according to the prevalence of diseases present in the society. So this is very important. If the curriculum is not balanced, and if cognitive learning outcomes are given undue focus, affective and psychomotor outcomes are compromised, leading to lack of competence for the professionals. If balance is absent, development of logical and linguistic intelligences of learners may not occur. Then curriculum may also be too knowledge oriented, too society oriented, or too learner centered, when in fact it should consider all these three bases of the curriculum. So such curriculum is lopsided and not balanced. We want this knowledge, skill, and attitude to be developed appropriately in a balanced form to develop a compassionate professional. So we have to balance our curriculum in all these three domains, and also in according to the prevalence, society's need. All these has to be considered when you wanted to balance a curriculum. Then balanced curriculum provide provision for learners to be responsible citizens and world managers who can envision and realize a preferred or a desired future for the present and future generations. In this light, answers should be given to such questions: how much curriculum content and learning experience must be devoted to social, economic, political, and other social concern, and to the transmission of a cultural heritage of a country. Then, how much will be devoted to accumulated body of knowledge in the different courses and fields of study that comprise the curriculum. Then, how much emphasis must be given to the learner's interests, needs, and demands? What should be the ratio of general education courses to the major courses? The elective and the optional courses, what should those courses be? All this has to be considered. If you keep an elective and or optional course, for a nursing, we keep some languages like English is there, BMT is psychology. All these are optional courses earlier. Now it is included in the course itself, because we need to think about the society. Then what should those courses be? Elective, if you wanted to include in nursing, yoga can be elective because it comes under the holistic medicine. Ayush also. Like this. Curriculum developers should make a list of all the courses that they offer per program together with the actual and desired time allotment per course. The list will show the discrepancy between the actual practice and what is desired, which can serve as a basis for designing for balance in a curriculum. Then decision on the desired time allotment will reflect the emphasis placed on the different courses. These decisions can be based on the extant literature that reflects the best thinking on the problem, educational philosophy of the school, and the curriculum orientation of the decision makers. It must be mentioned, however, that the balance does not mean equal emphasis, but rather covering what is deemed essential and important for learners and for society. That I have already explained when I was talking to you about the 68% of medical surgical cases and all this. In the last analysis, balance is relative and it takes objectivity or freedom from biases and a broad perspective to design a balanced curriculum. See, when I have seen as a member in the curriculum task force in many places, even in Oman, I have seen that specialists in each area. I am a specialist in child health nursing. So I feel that my subject must be given more weightage. The other person in psychiatric, he or she may have their own rationale for including more topic on psychiatric nursing, like this. But it should not be like that. It should take objectivity and freedom from bias to design a balanced curriculum. Then we have talked about the elements, components, dimensions of curriculum design. Now we briefly go through what are the types of designs. There are different types of designs available. These designs may be broadly categorized into following major groups: traditional or subject-centered designs, which we call our medical model in health science, then learner-centered designs, problem-centered or society-centered designs, and unified designs, etc. And again, another classification: subject designs, discipline designs, broad field designs, correlational designs, process designs, etc. Then traditional designs are subject-centered. The oldest and best known design, this is related to textbook treatment and teaches us subject matter experts, SME, subject matter experts. ഒരു ഐഡിയലിസ്റ്റിക് ഫിലോസഫി ഒക്കെ എടുക്കുകയാണെങ്കിൽ നിങ്ങൾക്ക് കാണാം നമ്മുടെ ഗുരുകുല വിദ്യാഭ്യാസത്തിലൊക്കെ വരുന്നത് പോലെ ടീച്ചർ ഈസ് ആൻ ഐഡിയൽ പേഴ്സൺ. He knows everything under the world, under the sun, like that. And on that subject, who is teaching mathematics is capable of talking about mathematics in any area, any part of mathematics is known to him. That feeling was there. This is the baddest part of a subject matter curriculum. I just mentioned this. The emphasis is on making learners absorb as much knowledge as possible concerning a particular course or broad field. One traditional design is subject-centered or subject-specific. Another is the correlated design, where the subject boundaries are still present but related topics in 2 or more courses are highlighted. Then the best traditional design is broad field. We call it as multidisciplinary curriculum, which is a fusion of 2 or more related subject or courses. അതിനൊരു ഉദാഹരണമാണ് earlier the medical MCI and Indian Nursing Council also made maternal and child health together, and most of the hospitals also, maternal and child health hospitals. This is a multidisciplinary curriculum. Everything together they study about mother and child together. Then strength of this introduces students to essential knowledge which require to live in the society, easy to deliver, textbook and materials commercially available. Traditional designs are easy to develop and implement because these are highly structured. But these designs have weaknesses. This empowers students to choose the content which is most meaningful to them, presented without consideration of the context, fail to foster social, psychological and physical development, neglect student needs, interest and experiences, foster students' passivity. For example, when you are giving a lecture and if a textbook is available, how many students will take lecture notes? They will think that we will hear this and we will go and read the book because the textbook is there. Then correlation design, in the middle of separate subjects and total content integration. In this attempts to identify ways to relate subjects but maintain their separate identities. Students in a chemistry course may have a unit in maths that deals with the mathematics required to conduct an experiment. So, example, science and maths, literature and history together. Strength, innovative and attractive. Weakness, time consuming. Teachers often separate department, and then scheduling difficulties may arise. Then comes the process designs. Urge students to learn the process of obtaining knowledge. Example, biological procedures to learn biology, ethnographic procedures to study culture and society. Strength, the students as a meaning maker enables to analyze reality, create frameworks by which to arrange derived knowledge. Weaknesses, difficult to analyze validity of students' conclusion individually. This happens in problem-based learning and all. This is process designs. Best example is problem-based. And again, another classification: subject designs, discipline designs, broad field designs, correlational designs, process designs, etc. Then briefly, what is learner-centered design? May be based on anticipated needs and interests of the learners based on their stage of development. Usually, this curriculum is built upon normal activities of children engage in, such as playing, storytelling, drawing, and the like. In this kind of curriculum, content is not organized into subjects like mathematics, English, or science. Instead, content may be subdivided into courseworks such as storytelling, playing and singing. With these subjects are inculcated. The 3 R's will be integrated in this activity: rigor, relevance, and relationship. We can also take it as reading, writing, and arithmetic. Instead of arithmetic. So I hope you understood what is learner-centered designs. This is design criticized as neglecting the intellectual development of learners, especially in the elementary grades, where learners are supposed to be equipped with the basic understanding and skills needed for the next higher level of schooling. But the thesis requirement in graduate school and in some tertiary schools is anchored on the learner-centered design. Actually, our curriculum are multidisciplinary, I should say, because it uses many designs together. These educational levels also make provision for broad field design and society-centered design through social action and community outreach program. We use these things also. That is why I am telling you, our curriculum design used a multidisciplinary design approach, using different designs in different areas. Society-centered design, I don't think that I need to go very elaborately on this, but please remember that this is based on the reconstructive philosophy of education, and curriculum is heavily loaded with societal concerns, problems and issues. The curriculum the other curriculum designs are drum plan, spiral curriculum, mastery learning, problem solving curriculum according to Hansen 2001, problem center designs, life situation design, or constructivist design. Then the spiral curriculum is built on 2 psychological foundation: connectivism and constructivism. The spiral dynamics also has come out from spiral curriculum, where problem solving is used by the technique spiral dynamics. Then mastery learning is a curriculum design that purports to offer opportunity for all students to succeed by giving individual students all the time they need to master the objective. That is a type of competency-based curriculum. Mastery learning means competency learning. So competency-based curriculum is otherwise called as mastery learning. To conclude, problem-solving curriculum has received a renowned level of interest in American schools because it enables students to learn the topic at a greater depth and affords them opportunity to study new information to prior understanding. Most mastery learning programs are individually based, making them attractive to those teachers who are dedicated to meeting the needs of diverse group of students. Then the curriculum designs are all different, but they all have certain features in common, such as scope, sequence, continuity, articulation, and breadth. Please remember this. Success with any of these designs depends on teachers understanding the underpinning philosophies and the quality of instruction used with these designs. These are the few bibliography which you can read. I hope you understood. Thank you for your patient listening. If you have any queries on this, please put it in chat box and send to me. Thank you very much.